but hello and thank you everybody for joining us today. I'm Kelly Grover and I'm the CEO of Cystic Fibrosis Canada. And I'm really pleased that we're doing this webinar with you today. I'm joined by Kim Steele, the Director of Government and Community Relations at Cystic Fibrosis Canada, and Chris Black, who's an extraordinary long-term volunteer with CF Canada. She's a CF parent and she is the BC Provincial Lead for our National Advocacy Network. So in our meeting today and with you, we wanted to do a few things. So first, we wanted to let you know what we're doing now to advance access to modulators, and particularly to let you know how you can be involved and what you can do. Secondly, given that one of our activities is a challenge for our community to meet with their provincial elected representatives, we want to ensure that you guys all feel comfortable and empowered to take those meetings. So we want to share some of our experience on how to successfully have those meetings and to navigate some of the challenges that we've faced. Sometimes people are nervous, as I said, about these kind of meetings. They don't think they have the experience or the ability to meet with their elected representatives. I've heard people feel that they're a bit intimidated with it. And then there's others who just don't think it's particularly a good use of their time. So today, after our webinar, we want you to know, importantly, that you're already skilled to have these meetings. And secondly, they do make an impact. And so we will share some of our lessons learned. I called it the good, the bad, the ugly, so that you can walk into these meetings and feel prepared to make change, but really to be prepared for some of the things you might be a bit worried about. So to kick us off today, Kim is going to share some of the work that we're doing and let you know how you can be involved. She'll share some of her experiences. Chris will as well. I will, and then we'll take some of your questions at the end and have a bit of a discussion. So Kim?
Thanks, Kelly, and thanks everyone for joining us today. I'm just pulling up my slides here. And I will start my presentation. Bear with me for one moment. Just a little technical glitch here. There we go, sorry. Okay, take two. Okay. So as you can see, we are calling this challenge the CF Can't Wait Provincial Meeting Challenge, and it is part of a larger campaign. There are really 4 prongs to that campaign. The purpose of the overall campaign, the CF Can't Wait campaign, is to get commitments from all of our provincial leaders for immediate coverage of Kalydeco, Orkambi, and Trikafta upon Health Canada's approval of Trikafta, which we are expecting on June 23rd. How are we going to do this? We're going to launch the provincial meeting challenge, as Kelly mentioned. We will also have an online petition that you can sign, the letter writing campaign, and then several opportunities to engage and show your support through social media. You may recall last year we did a CF Can't Wait Member of Parliament meeting challenge, so focusing at the federal level. And we came together as a community, and through that challenge, we ultimately got beyond this map. We met with 40% of members of Parliament. And, you know, at that time, we were looking to stop some guidelines that were, and regulatory changes that were impacting the ability to bring drugs like Trikafta to Canada. So we wanted to stop those changes, and we wanted to make sure that there was a clear path for Trikafta to come to Canada. So, you know, through that campaign, we were able to meet with 40%, or about a third of just over a third of members of Parliament, and about the third of those members of Parliament supported us in a first-in-kind initiative, the Emergency All-Party Access to Trikafta Caucus, which really helped us push the bar and really raised the knowledge of why we need these modulators to get into the hands of Canadians with cystic fibrosis now. So in terms of looking forward now, it was really the success that we had in the CF Can't Wait Member Parliament Meeting Challenge that brought us to where we are now, which is the CF Can't Wait Provincial Meeting Challenge. And why the provinces? The provinces have the primary funding role for medicines. So we want to make sure that they hear loud and clear that we need these medicines funded as ASAP, right at that Health Canada approval. So with respect to getting access, I will say that the front of the system, so Health Canada and the cost effectiveness bodies have coordinated. And so we are seeing the drug move at rapid speed through our system at the front end. But the back end, where the provinces are, the public reimbursers of these drugs, those who cover drugs for people with cystic fibrosis or don't, as the case may be, their processes are a bit more loosey-goosey. There's not a lot of transparency or accountability in the negotiations that they have with the manufacturer, and there's not always a sense of urgency to get these drugs into the hands who need them. So we really need to create that sense of urgency, and we need your help. So the Provincial Meeting Challenge is one way in which you can help. So who will be participating in the Provincial Meeting Challenge? Hopefully you, along with hundreds of community members and partners. And as Kelly said earlier, it doesn't matter if you've done this work before. We are here. We can support you right through the challenge, as we were able to support last year's challenge. And I'll get into some details about that later. What is our goal? We want to meet with as many provincial elected officials as possible in each province. There's 720 ridings across Canada, so there's lots of territory to cover. Where? Virtually, through constituency offices, so you won't even have to leave your own home. Most elected officials are now using Zoom, and their staff would work with you to set up a Zoom meeting. And why are we looking at constituencies? Well, that is where the power is. The relationship between an elected member and their constituents is one of the strongest relationships that is made in politics. And these can be really long-standing relationships. They often start with just a meeting. And so, your members are generally, most members want to do a good job and want to support their constituents. And we want to help them understand our needs so that they can be better champions around their caucus table, in speaking to the minister, the premiers, whatever action we would like them to take. We want to make sure that we're giving them the support that they need to take that action. And then how? We will provide you with information online to help you have a meeting, as well as a series of wraparound supports and the tips that we're going to get into right now. So when we think about a meeting with an elected official, I tend to think of it in kind of a life cycle model. What we do with meetings, sorry, I just lost my right, there we go. What we do with meetings in general is try to convey information, but also try to build a relationship, because let's face it, some of these decisions to fund medicines, they are long-term negotiations. They are long-term, there's long-term advocacy work that needs to happen to get some of these medicines covered. And most of the modulators, all of the modulators, are going to require heavy lifting, and they have thus far. So, when you start a meeting, your first meeting with an elected member, I always, advise people, think about how this person might be able to help you in the future, right? Maybe they're on a fast track or a slow track to a ministerial appointment or a critic. But always think about the role that that person might play within their party and within the broader, governance structure of your province, because those are the people that you're going to want to forge longer-term relationships with, up and comers and people who, quite frankly, stay in office for a long time. These are the people who can help you long term and short term. So at the heart of our meetings, in any meeting, I always talk about getting background and briefing. And this is the research that needs to be done in order to go into the meeting and feel confident. And we have provided those background materials, and we're doing weekly briefings, Wednesdays at 1 o'clock Eastern Daylight Time, and we will record those briefings. It's really an open house type of briefing. You can come, you can sit in, you can offer advice. Maybe you had a meeting and you had a challenging moment. We can talk that through with other people who are on the call, but it's really meant to talk about, did we see any commitments made? Have we seen any interesting meetings that were held? And is there something that we can learn from each other in this exchange that will help others have a better meeting? So it's very much, like I said, an open house roundtable format, and it's very informal, and everybody's welcome to come. You can find more information about that on our website, and we'll include links at the end. So, you've done your background, you've been briefed, and you're going to make your meeting request. Well, we have a template that you can use to make that meeting request that you can tailor to make it your own. After you send the meeting request, you have to follow up. Sometimes follow-up can take a long time, and it can be defeating. But persistence, politeness, all of those things, you will pay off in most cases. Once you, follow up and you secure a meeting, they're going to want you to send on materials, like a briefing package is what we call it for government. So we have that briefing package, and we're updating it in real time as new information comes in. You'll be able to find that on our website as well. Then you have the meeting. And I'm going to go into on the next slide how a meeting structure generally works. And then after that meeting, we're strongly encouraging everyone to use our online meeting tracker, also on the website, to report your meetings, because that is where we're going to know where we have coverage, where we have momentum, and where the gaps are that we need to fill. So we have mapped all 720 ridings across the country in collaboration with members of our National Advocacy Network to see where we have coverage. And they have slowly started to warm the ground in the ridings where we have coverage, but there's still a lot of ridings that need to be covered. And so reporting lets us know that we have some coverage in that area, and that there are people who either have a relationship or are starting to form a relationship with that elected member. And then again, follow up. So for example, we're going out now, we're asking for commitments to get these drugs funded. When the decision is made by Health Canada, and then subsequent decisions about reimbursement, we're going to have to follow up with them to tell them what we think of what they've done. Have they provided a really comprehensive listing to these medicines for everyone who needs them? We want the broadest based prescribing criteria for all. And we know that has been a challenge for many drugs. So we're going to need to keep that follow-up loop going. I've included the follow-ups there quite intentionally as two, because there's follow-up at the beginning, there's follow-up at the end. That's what helps you transition into the next meeting cycle. And that's what helps build that relationship over time. Running a successful meeting. So Chris will get a little bit more into this, but I'm going to give you some high-level overview. So the first thing we ask people to do is when they go into a meeting is do your introductions. Usually people go into a meeting with 2 or 3 people, people with different stories, maybe a clinician. So we walk in, do your quick intros, and always do a time check. I know that we scheduled for half an hour. Does that still work for you? And I say that because politician schedules can change like that. And so getting that time check at the beginning will let you know how long you have to tell your story, build a case, and get that person's support. So the next step is asking, so may I ask, how much do you know about CF? And then sharing your personal stories, your connections to cystic fibrosis, and why why you are here today in this meeting, and what we are looking for in terms of support. So that goes to the background where you build to ask. That's where our briefing notes, our briefings, these are the arguments of why we need coverage now. So there's the personal story, which really hits the emotional side, the facts and figures, which makes the case for coverage, and then you make the ask and the policy ask, and that's a good opportunity to get feedback and say, so, would you be willing to support us in this ask? The member might say, well, I need more information. Can you answer A, B, and C? And that's when you might say, well, I can answer A and B, but I can't answer C. So, maybe I'll get back to you on that. And so we always ask that if you don't know the answer to a question, just say you don't know, and you'll get back to them. And they usually appreciate you taking the time to get them the right information. So you've made your policy ask, you got your feedback, you've answered questions, you find out where that member sits. And if the member says, yeah, I'd be willing to ask a question, in question period, you take that, you recap, and you can come to us because we have a bank of questions that we can adapt to your province and to even individual speakers. So, we can provide you with content that either you can massage or your elected member can massage, but it will have all of the right key messages in terms of making sure that we get the ask delivered to the minister in question period. We are also, looking at ways in which we can keep the momentum growing and amplifying. So we're asking that if you're going to be meeting with all of these provincial members, talk about it. If you have a member who's been really supportive, thank them. If you're facing difficulties getting meetings, we have, opportunities to talk about maybe why that is. And I think by showing some of your members where other parts of the country are getting meetings through some of our social media posts, may help apply a bit of pressure on them to meet with you if you're having problems. And we're just asking, retweet or like or share our posts about the meeting challenge so that more people see it and more people go, hey, maybe I want to get involved with that. Post your own videos and tag us with the CF Can't Wait meeting challenge and Trikafta Can't Wait. And I think, we're all going to, as a community, just try to lift everybody's messages up and really create a cacophony of support for moving forward quickly to get these drugs. Tips and tricks. We thought we'd talk about some of the more challenging scenarios. So a tip that a former staff member and now volunteer of ours really, I think, finessed is the email call strategy. He worked in a minister's office and he answered a lot of calls, and he said, the best thing is you call me, you tell me I'm going to send an email with a meeting request, and then you call me back right after you sent it. And it's a really good advice because these people get hundreds of, some may get thousands of emails, in a day or within a few days. So making your message or your meeting request stand out is really important. Speak to the staff and to the politician as human to human. Sometimes, politicians can be not so nice, and the best thing then is usually to say, okay, well, thank you for your time, and move on. And it might be because it's not their issue. It might be because they're busy. It doesn't make any of that right. But what it is they're human beings and they have certain duties and obligations. It's our job to make them want to pay attention to our issues. And we do that, you know, they say you catch more flies with honey, but we do that often by really seeing them as human beings, and making sure that our actions in our meetings with them are on that level. Also, I think plan for a half an hour, be prepared for an elevator pitch. I'll tell a very short story and then I'll shortly be turning it over to Chris. But when I was an Alberta student leader many moons ago, we had started a postcard campaign directed at Premier Ralph Klein, because he had done 3 years of tuition cuts. So what we did is we had all, you know, of the student organizations and the campuses from across Alberta send postcards to the Premier to talk about the impact that you know, his cuts were having, because he would not meet with us for 3 years. We just couldn't get in to see him. And we were actually there one day pulling a stunt, and we had a media press conference, and we thought, how else are we going to get these things to the Premier? So we had a wheelbarrow full of these postcards, and they let us into the legislature, and we went into the, you know, an elevator, and then just the doors were closing. Who walked in but Premier Ralph Klein? And he said, "What are you doing with that wheelbarrow?" And we said, "We're delivering it to you because, you know, you need to know how your tuition cuts are impacting students, you know, in Alberta." And he said, "Well, I'll think about it." You know, and a few years later, the cuts did start. I'm not saying that was, I wouldn't say that was a successful meeting per se, but what it was is it grabbed his attention in a way where he associated us with that tuition call. So, you know, sometimes you have to think really creatively and out of the box, and those types of stunts can sometimes really help to at least start a conversation. And that's, you know, that's something that obviously if the media is involved, we do have a communications team who can offer advice and assistance. So that elevator piece leads up quite nicely to the planning for a half an hour, be prepared for an elevator pitch. So often, as I mentioned, a member's schedule might change, and you thought you had a half an hour, but now you only have 15 minutes, or you only have 5 minutes. So we always advise that, you know, take your top line points, make sure you know those ones really well, and that you can say them really quickly, just in case your time is cut short. And then we can always try to do a follow-up meeting to get into greater depth. Yes, and I think by being prepared, you will be able to anticipate the typical questions. So where are we at right now? As I mentioned, our national advocacy network started to work on the ground, but you can see there's still a long way to go. And then, you know, we're working well into June, so there's still some time to really have an impact on growing the movement. And you can help by joining the meeting challenge, and we will provide all of the training and tools and support that you need. And you can also, you know, if that's not for you, we'll have our petition, letter writings, and other ways in which you can amplify your support through social media. And we'll be showing these maps regularly, and the reporting to our online meeting tracker, that's what feeds these maps. So you will be able to see where the coverage has been had. We'll also have a listing for each province of ridings that we need covered that you can download from our site. As well, we will also have the tools that you need, including what I mentioned as the government relations briefing kit. There's a toolkit that just talks to and tells you all about the challenge and how to do the challenge. And then there's those on-demand materials where you might, you know, call our office or shoot us an email and say, I had a meeting with so-and-so and they want to make a member statement, and we can get you some sample member statements. So this here These are all of our links. We are recording this, so you can take a picture or wait for the recording, but this is where you can find the tools and everything that I spoke about. With that, I'm going to turn it over to Chris Black.
Thanks, Kim. Boy, that's a lot of information. It's great and so helpful. What I think I'll start with just going back a step to why I believe advocacy is so important. And I think the only way we will get the kind of care and support for people with CF that is needed and that they deserve is to educate the decision and policymakers. They won't know what we need unless we tell them. And I think Kim talked about this, but we really need to build these relationships, the relationships with our elected officials and our non-elected officials. We need to become friends with them so that they will want to help us. I have to say, CF Canada has a great training program for people who are interested in advocacy, and the support is incredible. I chose to be part of the advocacy team because really, if we don't do this, then who will? I know I'm meant to talk about the success of the BC MP challenge, and I think we were really fortunate. And out of 42 ridings, we were able to meet with 39 of the MPs. If I could say that we had a secret weapon, I would. But really, I think it was a combination of luck, hard work, and persistence. And to be honest, we could never have done it without the support of the team from CF Canada. They helped us plan and prepare for almost every meeting. And to begin with, we did start with a pretty strong team of experienced advocates. I think we had about 18 that we started with. I'd love to recognize them all and name them all individually, but I know it would take a little bit too long, but I think they know who they are, but they really deserve a lot of credit. And we grew our original team of advocates through social media. We encouraged people through social media to, especially in ridings where we didn't have constituents or didn't have family members or people who were in the CF community, we encouraged them to contact us and let us know they were there. And then also through the CF clinics, we're really lucky in BC, well, and I know across Canada that we have really great relationship with our clinics. And so we let the clinics know which communities or which ridings we didn't have anybody in the CF community. And if they knew of anybody who they thought would be interested in helping us, they put us in touch with them, and that was really helpful. And then finally, our support from Kin Canada was really helpful. So we were offered the support of Kin Canada, and we did go to our Kin CF liaison committee, District 1 person, and we let her know which communities we needed help or didn't have anybody in the CF community. And she reached out to the kin in those communities, and sure enough, they stepped up and helped us. They helped us with meetings and with preparation meetings. So we're so grateful for kin support. And basically, we ended up with having a constituent in almost every riding. So then I just thought I'd talk a little bit. I know Kim talked about this, about getting meetings, but I think this is where a little bit of luck came in for us. We had the advantage of having the skills, expertise, and contacts of a former MLA, and this MLA was Lorne Mayencourt. He was a Liberal, and he has a family member with CF, and so he was really committed to helping us. He had many connections with MPs, and he encouraged us to use his connections to help get meetings. And then he didn't quit there. He helped us prepare for the meetings. He attended many of the meetings, and he really helped us plan, because he knew what MPs needed to hear. So he really helped us with that. And then I think we were really persistent with getting meetings. And as Kim talked about, using email and phone calls. And so that's what we did. We would email a request, and then most often, sometimes we heard back, but certainly not always. And so we would follow up with a phone call, and sometimes 2 phone calls. So I think if you send an email, don't give up. You really need to follow up with a phone call. And often it's surprising. They'll say, oh yeah, I saw your email, but they wouldn't respond unless you phoned. So really important to do that. And then I think for us, our preparation was really important. And I think our preparation helped people, our volunteers, our volunteer advocates, it helped them feel confident and supported. So the first thing we did, of course, was to offer the advocacy training and mentoring to anybody who was interested. And then we teamed our newer advocates or families who were interested in helping. We teamed them with a more experienced advocate. And so that often really helped in the meetings, because the role of the newer person would be to tell their CF story. And then the more experienced person would be to talk about the issues and where things were at. So I think that was really helpful. And we almost always had a preparation meeting, and thankfully it has been so helpful having these virtual meetings. So we would have a preparation meeting with all those who were going to be attending the MP meeting. And we were often lucky enough to have Kim Steele or Eric or Lauren Mayencourt attend these meetings to help guide us through and help us prepare. And then we would provide a written summary of our preparation meeting, and that acted as a guide for the meeting with the MP. So, and for some of these meetings, especially meetings with ministers, we actually had, and this was something that Lauren really helped us with, was we had a minute-to-minute guide of who was going to say what and what they were going to say. And that really helped us make the best use of our time with the MP, because as Kim said, you don't often have a lot of time. We were very fortunate, and several of our meetings went well over time, but we definitely planned for, actually we tried to plan for less than the half hour. And then, as Kim also mentioned, CF Canada has amazing briefing notes, and we would send the briefing notes ahead of time. And it was interesting that the number of MPs who actually referred to the briefing notes, sometimes they didn't, but often they did. And again, the virtual meetings made it easier for either myself or Kim or Eric or Lauren or any combination of us to attend the meeting along with the constituent or the advocate in that riding. And then, of course, and as Kim mentioned, we would always send thank you emails. And if I had attended the meeting, I'd send a thank you email. And then the constituent would send more of a personal email thank you. So I think that was really helpful in continuing the relationship with these MPs. And then I was just going to quickly talk a little bit about our best meetings, or what made some of our meetings what I'd call our best meetings. And I think the best meetings happened when members of the CF community who were attending these meetings really shared their stories of living with CF openly and honestly, and talked about what having access to Trikafta would really mean to them, the impact it would have. And or if they already had access, we talked about the difference that it had made to their lives. And I think it just was so important to connect with the MPs on an emotional and really personal level, and also in a very respectful way. And I think that's when the MPs were really responsive. And I have to say, I really can't think of any meeting where we didn't have a positive feeling at the end of that meeting. So I think our elected officials, they really, they want to hear from us, and they do want to be helpful. So, I don't think we need to be afraid of that. And then I think the other thing is we always made sure there was time for discussion for the MP to ask questions and to have that discussion. So I think those, that's the basis of what made our meetings successful. So yeah, and I'm happy to answer any questions. And I think Kim, I know you already talked about tips and tricks, but I'm sure there's more that you've got to talk about.
That's great, Chris. I'm going a bit off script here. There's a shocker, but that's great. And I love that you shared that you haven't had any negative experiences as well, because I think people are sometimes people, maybe nobody on this line, there's a lot. I looked at the participants. We've got the A team here, people with a lot of experience, but I know people are nervous about that. And I think it's really important to stress that people do want to hear, and they're very moved by people's stories, and it's, you're already expertise in that. So that's really helpful. Kim, did you want to share any other? I've got a few notes to share.
Yeah, you go ahead, Kelly. I'll
Okay.
the Q&A.
So there's a couple things I was just going to share, and I scratched some additional notes as I was thinking of things when you guys were talking. But sometimes people will say to you, because I've had many good meetings, but sometimes it gets a little slippery, and they'll say, there's really nothing I can do for you. Sorry, this is out of my area. We need to wait for the decision-making bodies to, this is based on evidence. So we need to make sure, especially with drug access, things go through the proper channels. And we have a concrete ask. So Kim has outlined the ask that we want them to fund, and there is something concrete that they can do. And we're going to ask them to, whether it be write a letter to the Minister of Health, stand up in the House, whatever it is, we'll have a concrete ask. And you need to stress that they have the power to do something for us. So I think there's sometimes a bit of a cop out to move this into it works through science and evidence, and it does, but I will tell you the squeaky wheel sometimes gets things done, and we're certainly seeing that with the vaccine rollout. So the one thing that I really wanted to stress, because we hear about this from some of our folks in the CF community, is many times, and I want to say many, many times, the elected representative will say to you, well, I have an idea. Why don't we do a petition? Or I have an idea. Why don't we do, I don't know what else. And so basically what they're doing is they're getting you to go back and do the work, and they're taking the onus off them to do anything. And I don't want you to let them do that. They have a responsibility to do something for you. So I would say stick to your guns, and you can say things like, well, those are interesting ideas. What I think we'd like to have you do is X, Y, Z. You can say, well, I'll take that back to CF Canada as a, if you want to get it back off of you. But they will many, many times send you down a pathway of like some new great idea that they have. And they're, again, probably best intentions, but I just want to keep that up. And go ahead.
Just one thing about petitions. So there's the kind of, government sanctioned positions that require, it's a lot of work generally, especially in the provinces, because most of them are paper based. So it always sounds like a good idea. I'll just do a petition and show support, but it's actually quite onerous, and it can take months just to manage that. So, that's all. It's something that politicians often do, as Kelly said.
Yes, and then the last part I did have on stories. Stories work. Like I cannot stress that enough. Stories, and Kim and I can tell your story, but I can tell you, no one wants to hear us tell your story. So your story, we're the nerds that come in and talk about the efficacy. Your stories make a difference. The one thing I wanted to say on these aren't negative meetings, but this is something Kim and I'm sure Chris, you've heard this as well, and many of you will, but sometimes it gives people pause, and it's this. these drugs are so expensive. These drugs, I've heard, I mean, my first meeting with Doug Ford, that's the first thing he said is, I've heard these drugs are so expensive. And Kim will have messaging for that. I'm sure we have messaging in our toolkit to get out, but don't get flustered with that. You know, I don't have as much experience as Kim, but I will say I have to kind of get prepared for that questioning. We don't know what these drugs cost. That's my answer right now, because we need to get them negotiated. So, but we have messaging for that to get you out of that area. The one thing I wanted to just stress is people that go into politics often go into it to do good, like Chris talked about, but they also, there's another side of it of they want to be seen to be doing good. And they want to be seen as a champion for helping to make change. And please lean into that. Help them, if you want to say help them lift their ego, but, lean into their ego. That's where the pictures come in. But, you can use those words of you can help, these drugs are transformational. You can help transform people's lives by doing this. You can be a champion for, and if you have for me or from whoever you're talking about, but remember that is a key part of sort of how you're positioning. And the last part I'll say is, and Chris talked about this, I love that you talked about it, is you were scripted almost minute, like second by second in your meetings. These are, your prep is as important as the meeting. So you need to know about your fella or your woman you're going into, and then you're angling, you're marketing your story or your material to fit them. And I can tell you, I've had 30-minute meetings, but not very often. It's usually you get in there and you're like, okay, 7 minutes, go. So you have to be quite nimble in that. And that's it for me on that, Kim.
Kelly, can I just say one thing to add to what you were saying?
Of course.
The other thing that I think works really well is when you know something positive that they have done, and if you recognize them for that right away in the meeting, they pay so much more attention. If you said, wow, I really am happy about what you did about such and such, or it's great that I see that you were a teacher before you came into this, anything like that, and they just respond right away because you have paid attention to who they are and what they've done. So I think you mentioned.
Absolutely. I was saying it a bit negatively, but I don't mean it that way. People go into politics are not shy of attention on themselves. So lean into that, like recognize it. Kim talked about being friends, both of you did, but help them be seen for their wonderfulness. Go ahead, Kim.
I agree with that. And the other thing I would add is essentially that, when you're meeting with your politician, try to find out something personal about them. If you walk in, like, for example, Dean Allison, Member of Parliament for Niagara, you walk into his parliamentary office, it's filled with wine. And you're just like, okay, he is promoting wine. He's obviously interested in wine. So maybe I talk to him in small chat about wine or hockey or whatever, like just to break the ice at the beginning. It makes a huge difference. And if you're nervous at all, it really helps to deal with those nerves. So yeah, if you can find something in common that you have with the person that you're going in just to make small talk, that can go a long way.
Maybe we'll go to some of the questions that we have. So one of them, Kim, this will be for you. So I've met with my MPP Stan Cho and a staffer quite a few times. I was hoping to get a commitment letter from the health minister to add the modulators when it was approved by Health Canada. He felt that this might hinder negotiations with Vertex if they provided a commitment before PCPA negotiations were completed. Any suggestions on how to persuade?
Yeah, I mean, thanks for your question. It's a really good question. And, recognizing that Trikafta is a true game changer, England's National Health Service finalized negotiations with the manufacturer, and they agreed to fund the drug before regulatory approval, which is exactly what we're asking for. Health Canada is the regulator, the provinces are the payer. In this case, England's National Health Service was the payer, and the regulator is the European Medicines Agency. So what that allowed for people to do is a week after Trikafta received regulatory approval in England, a week after, people were getting Trikafta through their public payer, through their public drug programs. So we want nothing less for Canadians living with CF to have that. And, you know, I would also add this, is that Vertex negotiates with a lot of countries, and there are many negotiations that have included more than one drug. So, you know, there's, I guess I would say, show him some of those examples and say, there's nothing that, you know, is stopping us from doing this in Canada. So we can help you get those examples. If you'd like, just follow up with advocacy at cysticfibrosis.ca.
Great. Chris, this is for you, this question. What do you say when you call an MPP's office to make a meeting request? And what do you say when they're reluctant?
So usually I've already sent an email, so I refer to the email, and I usually say that I'm just following up on an email that I sent, and we're hoping to have a meeting. And then usually they say, oh, let me look, and they'll look through it. And then if they're reluctant, I'll refer, if it's me that's calling, I'll refer to their constituent and just say, well, you know, this person is a constituent, and they're not phoning right now because their child is sick or they're not feeling very well or whatever. And then sometimes that gives them a little bit of pause, and then just say they would really like to have a little bit of your time to talk about how cystic fibrosis impacts them and their family. And then, you know, usually they listen to that. And I mean, we have had one situation with this was with an MP where the assistant, we couldn't get past the assistant, and the assistant insisted that there was nothing that the MP would be able to do to help us. And no matter what we said, and when we said, well, we were meeting with all these other MPs, nothing seemed to work. And they just insisted that if there was nothing that the MP could do to help, then it was not a good use of their time or our time. So that was the only situation where we sort of couldn't get past the assistant. And I've never had that happen, you know, with anyone else, but it was kind of interesting.
It's interesting. We also have customizable meeting request letters on our webpage if people want to look at that as well. Okay, Kim, I'll maybe ask for both of you. Do you recommend that advocates in the same riding plan a meeting with their rep together, or would separate meetings be preferable?
Well, Chris, maybe I'll talk about an experience that I had here in Milton with Parm Gill, who's our member of parliament. Yes and no. I mean, it depends on the size of the group. I think if you have like 6 families in one riding, I might suggest you try to do 3 meetings with 2 people, or, you know, but because it's also important for the elected official to hear different stories and different perspectives. And when you have that many people, it's sometimes hard to do in a meeting, right? So that I'd say if it's under, say, 3 to 4 people, you can do it together. Once it gets beyond that, it gets a little tricky. One of the things that my member of provincial parliament did in response to some CF families that live here in Milton is he organized an open house. And we all went and we talked to him about the challenges and you know, the women who organized this with him from the CF community. It was a really powerful meeting, and they won him over in that meeting, you know, and it wasn't that big. It was like 5 or 6 people, maybe, open house. But, you know, that's another way that if you have a friendly elected official and you know there are many families, you might organize a group meeting or a caucus meeting, even better, in which you would meet with many members of the same caucus. Chris, over to you.
Okay. Well, yeah, I agree with what you're saying, Kim. And I think certainly my experience has been that keeping the meeting with not too many people there is probably better. I
Mhm.
think it also depends on what the elected official wants. So if there are, if we've got several or quite a few constituents, I'll ask them and say, you know, you have several constituents or this many constituents that I know of who are interested in meeting with you. Would you like us to meet with you at the same time, or would you like to meet with them separately, or and kind of do it that way? But I like them to know how many that they do have, as you know, there's several constituents who this is very important to, um, and then kind of leave it up to them how they want to arrange
It's a
it.
good,
The
it's a
other
great,
thing I would say is that our meeting tracker, our online meeting tracker, Chris, will capture that because we're capturing information by writing. So you can come in, you know, you don't even have to put your name if you're not comfortable. But what we really are interested in is what riding are you in? Did you meet with your elected official? And then once we run the numbers, we'll know, hey, there's, you know,
yeah.
7 families who participated in this challenge who are in the same riding. So how might we be able to strategize with those numbers going forward?
That's great. This question is, I'm going to do a quick answer and then I'm going to give it to you, Kim. If I'm using social media to acknowledge my MPP for being receptive and supportive, can I also use social media if they're not being receptive to grab their attention, i.e. tagging during CF Awareness Month? So I would say, yes, you can, but not in a negative manner. If you wanted to say, hey, MPP Kim Steele, looking forward to, would love to talk to you about CF during CF Awareness Month. I think as long as it's done in a not embarrassing or a derogatory manner, it can work. But I think otherwise, nobody wants negative press online. Like that's not going to get you a meeting, which is not what I think was the intent of the question. Kim?
Well, it gets pretty political, right? Because often when things happen like that online, you might have opposition members who support you, who weigh in. Like you know, it just can open up a can of worms that may exclude you from future meeting opportunities. Because one thing I do know about politicians is, you know, and because if you have an ego, if that ego gets hurt, they remember that. And so my experience, whenever I've seen any kind of negative messaging in social media or media, you know, whatever it might be, even letters to elected officials, it's never gotten a meeting. You
Yeah.
know, it hasn't helped.
And they have long memories. Chris, I'm going to give this one to you because I think I was going to ask it if we didn't get any questions. So I'm glad someone's brought it up because I think a lot of people are going to get this. Chris, what do you say when the MPP says, oh gosh, it's important, but COVID is the top priority right now?
Yeah, we've had a little bit of that, and certainly I would acknowledge that COVID is a pretty big problem, and we can and certainly understand how busy our elected officials are in dealing with this. But and then we'll talk about the fact that COVID is also hugely important for people with CF because they are greatly at risk. This is a largely affects the lungs, and COVID is a respiratory illness. So, you know, we kind of tie it in that way. And so, yes, we recognize that you're quite right. COVID is terrible, but it's also terrible for people with CF, and kind of make that connection. And I think, yeah, and actually that has happened. So.
It
But
happened to us last spring too, Chris, where we would say, and living with COVID is like living with CF. Let me tell you, like, and that really, my goodness, they're like, tell me,
yes.
tell me more
Right,
about that.
that's another really good one. But listen, I am going to have to sign off because I
I know, so
have
thank
a
you.
meeting with an MLA,
Yay, Chris.
a meeting challenge. So
She never stops. She never
yeah.
stops. So
So I
thank you so much, Chris.
well, and thank you to everybody who's attending. And please, everybody, do what you can and get in touch with Kim and CF Canada. Use the resources and let us know how you make out with your meetings.
Great. Thanks a lot, Chris.
Good luck.
Thanks.
Kim, we've got a couple more and we're about 4 minutes. I think we'll be able to get to them all. So the MPP's announced she's retiring and will not be running in the next provincial election in 2022. Should the person still try and meet with her?
I would say yes,
Yeah, me
because
too.
sometimes at the end of a term, they may have advice that they may not have if they're coming back. So
That's what I think. I think they might be more candid with you and they might tell you how to influence as well. For us, it could be good intel.
Yeah.
So how can we find out who else in our riding's doing advocacy work?
yeah, I mean, the challenge here is obviously, unless you're in the National Advocacy Program where you're part of a team, finding out who else has CF in the community gets just a bit tricky from a personal and health information perspective. I think probably the best way would be through some of the maybe chapters. If you were to come to us and we could talk to you about members that we might have in the network, we could partner you up with one of them. But I think short of doing kind of a general call, on social or something like that, we can probably help you find other advocates through our National Advocacy Network.
Yeah, I'd probably also, a lot of people online are part of chapters. I'd probably reach out to your chapter and find out, because it's local. So, and ridings, well, municipal or provincial ridings are a bit smaller, but you might be able to do some networking that way as well. So somebody's had a conversation with their MPP in Ontario, who's the parliamentary assistant to the health minister. They've asked her to do a member statement, but she was unsure if she can do it regarding the modulators. Do you know if that's actually the case?
Yeah, I mean, can't, I'd like to know what can't kind of really means, because from a procedural perspective, so from the rules of the legislature, there's nothing forbidding her from doing that. And in fact, she stood up and made comments before. Where there may be challenges is directly from the Minister of Health, who has said, I don't want you to speak, about these issues. That could be a directive. Maybe the minister will only speak to those issues. The other challenge might be that speaking terms and topics are really governed by the cabinet. So she would have to, win favor with the cabinet to speak about whatever it is she might speak about. Right. That being said, she might, we often think of questions and statements as something that could be adversarial. It can actually be a really positive opportunity for the minister to reinforce her messaging. So if you want to, get in touch with us and we'll help you reframe maybe the ask to say, hey, well, how about if you do a member statement and give the opportunity or a question to the minister and give the minister an opportunity to recommit.
Right. Great. Well, we're at the end of we could talk about this all day. You can see that. So I was going to do a long recap, but I'm not going to. Hopefully you took some notes and you can listen again. But I want to give you what I started with, I want to end with. You're ready to have a meeting right now. Okay. Kim has gone through with Chris some amazing tools on the meeting life cycle, how to have a meeting in the moment, being really prepared and scripted. But I'm going to tell you, all of you on the phone right now, and please spread the word in the CF community. You guys are all ready now because you live with cystic fibrosis and your family and friends do. And you have a story to tell because you know what the impact of these modulators are going to be. So the tools that the team has prepared that are available on our online will really help you with that. And so will these meetings that Kim's having weekly, where we can talk through some of the challenges and the opportunities you've seen. But I hope that has really given you some tips and tricks, and you have a good sense of what we're doing as well. And let's go get these things funded already. So thanks so much for everyone, and I hope you have a good rest of your day. Thanks, Kim.
Thanks everyone so much. Bye-bye.